Welcome to the St. Anselm College Coaches Education regarding sports medicine policies and emergency action plans. Emergency situations may arise at any time during practices or events. In order to provide the best possible care to the athlete during an emergency, quick action must be taken. All coaches must be CPR and AED certified. If you are not, you must contact Alyssa Van Patten for training. The chain of command for an emergency team includes the sports medicine team, made up of the team physicians, athletic trainers, and athletic training students, the athletic administration, game management personnel, coaches, athletes, and then bystanders. What needs to be done in the event of an emergency situation? First, care for the injured athlete. Second, activate EMS if needed. Third, gather all emergency equipment, so know where things are ahead of time, including the medkit, AED, and splint bag. And lastly, direct EMS to the scene. If you need to activate EMS, you can call from your phone, or there are emergency phones located throughout campus. Dial 911, then provide a name, location, condition of injured athlete, services requested, and directions to site. Make sure to tell the operator that you are calling from St. Anselm College in Goffstown, New Hampshire. In the event of an emergency situation, the sports medicine staff may use hand signals to communicate. During a serious on-field injury, all coaches and players should go to the bench area and ensure everyone stays a significant distance from the player. Do not try to roll or pull them. Once the medical staff begins to assist them, they should be allowed to work without interruption or interference. True catastrophic injuries, such as spinal cord injury, severe head and neck trauma, or partial or complete paralysis, should be reported to the NCAA Catastrophic Injury Insurance Program. In the event of a head and neck injury, some signs and symptoms are If you suspect a neck injury, keep the head, neck, and back perfectly still. Hold C-spine until help comes. If the athlete is alert, tell them to answer questions verbally and not to move their head. Avoid asking yes or no questions to prevent the athlete from naturally moving their head in response. Instead, ask open-ended questions. Some signs and symptoms of sudden cardiac arrest are chest discomfort, shortness of breath, palpitations, weakness, sudden collapse, loss of consciousness, no breathing, and no pulse. You just witnessed somebody have sudden cardiac arrest. What do? Call for EMS and perform CPR and use the AED. What is exertional rhabdomyolysis? It is the breakdown of muscle from extreme physical exertion. This is likely to occur when strenuous activity is performed under high temperatures and humidity. Dehydration is also a key factor. Symptoms of rhabdo include muscle pain or weakness in the shoulders, thighs, or lower back, low urine output, dark red or brown urine, fatigue, and feelings of being sick. Signs and symptoms may be hard to pinpoint because the course of rhabdo varies depending on the cause, and symptoms may occur in one area of the body or affect the whole body. In order to prevent exertional rhabdo, adjust workouts during high temperatures and humidity, emphasize the need for a good warm-up before activity, allow for acclimatization, and give frequent water breaks. Educate your athletes on the need for proper hydration throughout the day and not just during activity. If you think your athlete has exertional rhabdo, call your athletic trainer and in extreme scenarios, enact EMS. Bring the athlete to a cool, shaded area, administer fluids as long as the athlete is alert, and monitor the athlete until help arrives. Sickle cell trait is in people who have one sickle cell gene and one normal gene. Red blood cells containing the sickle hemoglobin change shape from round to quarter moon or sickle. Sickled cells accumulate in the bloodstream, blocking normal blood flow to the tissues and muscles. During intense exercise, an athlete with sickle cell trait is more prone to exertional collapse. Some signs and symptoms include Exertional or non-exertional collapse or fainting can occur at any time and may not be associated with exertion from a current session. Symptoms include dizziness or vertigo, nausea, fainting, decreased blood pressure, or a slower than normal pulse. If you have an athlete with exertional collapse, move them to a cooler environment, elevate their feet, and provide an electrolyte beverage. If they're not alert, enact EMS immediately. Call for your athletic trainer, remove excess clothing and equipment, and monitor the athlete until help comes. An athlete with asthma may experience an asthmatic attack during exercise. Common signs and symptoms include upright, leaning forward, fighting for breath, spasmodic or unproductive cough, whistling, high-pitched wheezing during exhalation, very little movement of air during breathing, hyperinflated chest, rapid shallow breaths, and a rapid pulse. If your athlete is experiencing an asthma attack, call for your athletic trainer and sit the athlete down. Make sure you remain calm and supportive to ease the athlete. Use their inhaler if they have one, and establish an airway and assist in ventilations if necessary. Emergency referral is not always necessary. An athlete may return to activity after an asthma attack when their breathing and heart rate must be back to normal. They must be able to take a slow, deep breath in and out. If the athlete uses an inhaler with little improvement, they cannot return to activity. Unlike an acute asthma attack, a severe asthmatic episode is a medical emergency. Signs and symptoms include bluish discoloration of skin around the lips, breath sounds may be almost absent, severe inflation of chest, extremely labored breathing, inaudible breath sounds, exhaustion, and dehydration. If a severe asthmatic episode is suspected, activate EMS. Establish the airway and assist ventilations. Treat for shock, and monitor condition and vitals until EMS arrives. Diabetes is a disease that occurs when your blood glucose or blood sugar is too high. Blood glucose is the main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin. Glucose then stays in your blood and doesn't reach your cells. Hyperglycemia in a diabetic occurs when there is too much sugar or too little insulin in the body. This can lead to a diabetic coma. This usually follows when a diabetic athlete forgets to take their insulin or overeats. Signs and symptoms of a diabetic experiencing hyperglycemia include dry mouth and intense thirst, an increase in restlessness and confusion, abdominal pain and vomiting, deep sighing respirations, weak rapid pulse, dry, red, warm skin, and sweet-smelling breath. So what do you do for a hyperglycemic athlete? If they are conscious, they need water or sugar-free fluids to help flush out excess glucose from the body. If they are unconscious, activate EMS, open and secure their airway, monitor vitals, and treat for shock. Hypoglycemia in a diabetic is when there is too little sugar and too much insulin in the body. This can lead to insulin shock. This usually follows when a diabetic athlete takes too much insulin, undereats, or overexerts. Some signs and symptoms of hypoglycemia include dizziness, lightheadedness, and headache, hostile and aggressive behaviors, fainting and convulsions, normal blood pressure, full rapid pulse, intense hunger, nervousness or shakiness, and pale, cool, and clammy skin. If an athlete is hypoglycemic but conscious, administer 10 to 15 grams of fast-acting carbs. Measure blood glucose level, wait about 15 minutes and remeasure. If it's still low, do it again. Recheck level again in 15 minutes, and if it still continues to be low, activate EMS. If a hypoglycemic athlete is unconscious, activate EMS, open and secure their airway, monitor vitals, and treat for shock. If available, prepare the glucagon for injection following the directions on the kit. Once the athlete is conscious and able to swallow, provide food. You did it! You kept everyone alive! The coach's manual you have been given has all of this information for you to refer to. Any questions, please contact one of your athletic trainers.